often come across people who have difficulty expressing themselves and understanding what others are saying. This is unrelated to hearing problems. Language disorder, formerly known as receptive-expressive language disorder, is very common in young children. So today's video, we are basically going to discuss about language disorders. A very frequent question asked by parents is, why do my child suffer from language disorder? And it's very difficult for doctors to give explanation, because oftentimes the cause of this disorder is unknown. Genetics and nutrition may play a role, but the explanations haven't yet been proven. In this video, we are going to deal with an informative content on language disorders. Number 1. Aphasia. It's a language disorder that affects a person's ability to communicate. And these are basically of different types, but here we are going to discuss about Broca's aphasia and Wernicke's aphasia. Wernicke's aphasia is caused by damage to left temporal lobe of the brain, whereas Broca's aphasia is caused by damage to brain's premotor area. Now, Broca's aphasia differs from Wernicke's aphasia in two key aspects. First is that speech is agrammatical rather than grammatical, as in Wernicke's. And second is that verbal comprehension is largely preserved. It can occur suddenly after a stroke or head injury, or develop slowly from a growing brain tumor or disease. Aphasia affects a person's ability to express and understand written and spoken language. Once the underlying cause is treated, the main treatment for aphasia is speech therapy.
It's something else.
Okay. So it's all in your head,
Yes,
but getting it out.
yes. I can read it.
The second disorder is autism. It's a developmental disorder characterized by abnormalities in social behavior, language, and cognition. Though it is biological in its origin, the genes responsible for it have not yet been conclusively identified. Children with autism are identified usually around the age of 14 months, when they fail to show expected normal pattern of interaction with others. When they interact with someone, they are more likely to view their lips than their eyes, and about half of the children with autism fail to develop functional speech. The speech which they tend to develop is characterized by echolalia, meaning they repeat over and over again the speech that they have been hearing. So it is 5 times more common in males than female, and the incidence diagnosed of autism has increased rapidly over recent years. Approximately 60 out of every 10,000 children have autism. Next, learning disability. Language-based learning disabilities are problems with age-appropriate reading, spelling, and/or writing. Most people are diagnosed with learning disability have average to superior intelligence. In language-based learning disability, many children with reading problem have spoken language problems. Thus, dyslexia has been used to refer to that specific learning problem of reading. Dyslexia is not due to mental retardation, brain damage, or lack of intelligence. It is caused by impairment in the brain's ability to translate images received from the eyes or ears into understandable language. The severity of dyslexia can vary from mild to severe and is found more often in boys than in girls. The sooner dyslexia is treated, the more favorable the outcome. Certain symptoms like letter and number reversal are most common warning signs of dyslexia. There is difficulty in copying from board or a book can also suggest a problem. The child may appear to be uncoordinated and have difficulty with organized sports or games. Many subtle signs can be observed in children with dyslexia, and due to frustration arising from difficulty in reading, children may develop withdrawn and may show signs of depression and low self-esteem. Everyone with dyslexia experiences the condition differently, but with the right support, people with the condition can excel like people without it. The next is Alzheimer's disease. Alzheimer's is a brain disorder that leads to decrement in language processing ability. This disease primarily afflicts elderly person and causes progressive, diffuse and irreversible damage to cortical region of the brain, impacting markedly on memory function. Alzheimer's disease is a progressive form of dementia. Dementia is a broader term for conditions caused by brain injury or disease which negatively affect memory, thinking and behavior. These changes interfere with daily living as well. Language impairment in Alzheimer's is primarily a result of decline in semantic and pragmatic levels of language processing. Semantic processing involves language content, such as word and their meaning, and the associated impairment include difficulties with word finding, naming, and word comprehension, as well as semantic paraphasia, choosing incorrect words, empty speech, using ambiguous reference, inventing words, and loss of verbal fluency. Alzheimer's is a complicated disease in which there are many unknowns. What is known is that the condition worsens over time, but treatment can help delay the symptoms and improve your or your loved one's quality of life. The next is specific language impairment. SLI is used to refer to problems in the acquisition and use of language, typically in the context of normal development, and first become apparent in the preschool years prior to formal schooling. Children with SLI lag behind their peers in language production and language comprehension, which contributes to learning and reading disabilities in school. Symptoms include the use of short sentences and problem producing and understanding syntactical complex sentences. SLI is also associated with an impoverished vocabulary, word finding problems, and difficulty learning new words. Whereas the basic tasks for development of phonology and syntax are completed in childhood, vocabulary continues to grow in adulthood. The next is developmental phonological disorders. It is also known as phonological disability. And these are a group of language disorders that affect children's ability to develop easily understood speech by the time they are 4 years old, and in some cases, their ability to learn to read and spell. Therefore, phonological disorders involve a difficulty in learning and organizing all the sounds needed for clear speech, reading, and spelling. Children with developmental phonological disorder have other speech and language difficulties, such as immature grammar and syntax, stuttering, or word retrieval difficulties. Children may leave out a sound even though they are able to pronounce the same sound when it occurs in other words or in nonsensical syllables. For example, a child who drops last consonants may say boo for book and p for pig, but may have no problem saying other words like key and go. This disorder is more common in boys, and the cause of phonological disorder in children is often unknown. Close relatives may have had speech and language problems. Appropriate speech-language pathology treatment is usually successful in eliminating or at the very least reducing the problem. Dyspraxia. Developmental dyspraxia is a disorder characterized by impairment in the ability to plan and carry out sensory and motor tasks. Generally, individuals with this disorder appear out of synchronization with their environment. The symptoms vary and may include poor balance and coordination, vision problem, perception difficulties, emotional and behavioral problems, difficulty with reading, writing, and speaking, poor social skills, poor posture, and poor short-term memory. Although individuals with the disorder may be of average or above average intelligence, they may behave immaturely. Developmental dyspraxia is a lifelong disorder. Treatment for this disability is through occupational and speech therapy or other form of communication such as using pictures and hand gestures. Many children with the disorder require special education. Thank you for watching. For more such informative videos, please subscribe us.